Hello. So, my name is Mirage Mack, and I will be covering the section on brain abnormalities that occur with Asperger's syndrome. So, for you, I have included two visual aids, one of a normal brain and one of a brain affected with Asperger's. So, if you take a look at the normal brain, you will see that there is a lot more activity in the frontal cortex, also in the top and back hemispheres of the brain. When you look at the brain affected with Asperger's syndrome, you can see that there is a lot less activity in the front, top, and back quadrants of the brain. I will further explain how Asperger affects the brain and causes abnormalities. A fun fact of Asperger's syndrome is that it is known as the genius disease because it causes the brain to lack in many different areas, but it also pushes the person affected with Asperger's disease to exceed expectations, which I will further explain later on in the presentation. So first, we will look at how Asperger syndrome affects the brain. Asperger affects the brain in many different ways, such as immature development of the cerebellum, amygdala, and the hippocampus. It also reduces the thickness of the right hemisphere of the brain. The so-called mirror neuron system's thickness is also reduced. The cells in the brain become smaller and more densely packed in certain areas of the brain. I will further explain how it specifically affects each part of the brain next in the presentation. So, this is the causes and effects Asperger has on the brain, specifically. So first, we're going to look at the frontal lobes, which I mentioned in the beginning of the presentation. This alters wiring that affects the social comprehension, categorization, and interest. So basically, this affects how they comprehend social activities such as interacting with friends or family. It affects the somatosensory cortex, which synthesize affecting sense inputs, stimuli, and coping mechanisms. So basically, when faced with the problem, this causes them to not be able to cope with the problems as quick as someone with a normal brain may be able to. It also affects the hippocampus, which is vitalized, affecting memory, association, calculation, and recognition. So this may cause them to not be able to recognize or associate memories that they once had. The visceral cortex, which is the visuospatial or hand-eye coordination, is also affected, slowing it down. Basically, their hand-eye coordination is way slower than someone who would have a normal brain. The amygdala is altered in arrangement, and it affects the emotions and response, also the fear and danger estimation. So with that, something that we may find fearful or may find dangerous, they may have to question it differently than us. It also affects their emotions, so they become more emotional or less emotional, pulling away or drawing more near than someone with a normal brain may. And it also affects their response, so they may not be able to read emotions as effectively as we would. For example, someone may have a frown and they may not be able to understand whether they're sad or they're mad. And also, lastly, what it affects is the cerebellum. It reduces the activity, affecting motor skills, interactions, and the stilting of speech. So basically, this affects their communication. The mental characteristics of Asperger's syndrome: the social interaction is impaired, communication is impaired, repetitive behaviors, obsessive behaviors, excellent grammar, which is what I was speaking about with the genius disease. It causes them to want to exceed expectations, normal cognitive development, normal or above the average intelligence. An experiment that was conducted was the gray matter study. So gray matter is defined as the darker tissue of the brain and spinal cord, and mainly of nerve cell bodies and branching dendrites. When given a CT scan to children with Asperger's syndrome, they showed a lower volume of gray matter in the bilateral caudate and thalamus. So thank you for watching my part of the presentation.